like we should like start off with like the audience is meeting for the first time, right? So maybe just like introduce yourself a little bit, like who you are and like everything.
Sure. All right. Thanks, Kushal. My name is Colleen Millen. Sorry, I just knocked my table there. My name is Colleen Millen, and I'm a licensed marriage and family therapist, and I work at Discovery Counseling Center in Danville. And for those of you who don't know this, it's a community mental health center, and we've been around for 30 years, and we have a lot of ways that we interact with the community. We not only provide sliding scale and insurance coverage, Medicare therapy, but we also do a lot of advocacy and reaching out into the community, which is how I got to meet your group. Someone connected me with your group, particularly because because I also run mindfulness-based stress reduction classes for teens at Discovery. But yeah, I work with teens through adults, primarily around concerns or about depression, anxiety, just sort of like learning how to cope, emotional regulation. I also have, I work with trauma and disassociation, so that's a little bit about me. And then, where I work in this community.
Okay.
Thank you.
Thank you.
First, we wanted to say thank you for your time, because I know this is like a stressful time. So I just want to start off the interview with asking, how do you think quarantine and social distancing have an effect on people's mental health? And I know that anxiety can be increased during this time. So just in general, what are your thoughts on that?
Yeah, I think the particular challenges of this time, and I just want to offer that this is anecdotal, right? I mean, I'm speaking in my positionality as a mental health provider and just sort of presenting some ideas about, from my training and what I do. But just generally speaking, this is an unprecedented time in which all of us have been asked to adapt in ways we weren't planning. So as an overall theme of why that might be stressful, just thinking about that reality. So we're all going to have a different process with that. And I'm sure you could all, as students, have a reflection on, what it was like not to have maybe the structure of school or seeing friends that you cared about the way you usually do, or, going to a class that you liked. And I'm sure there's a flip side of some benefits too, like maybe you didn't have to get up early in the morning or things like that. But there's just a myriad of things that had to change so quickly, so fast. And that can really have impact on folks. And, when we're talking about, so first of all, it's unprecedented. Second of all, there's still some revolving uncertainty as to what does this mean for us. So I think, with school ending, maybe that brings some sort of closure for people going to school in this sense. But even thinking about, okay, so, the adults in life are doing their best with health information about what this means for us. But at least for me, being 47, I'm sitting out here and saying, okay, so I'm still asking that question. What does this mean for me? How am I going to be adapting to make sure to protect everybody's right to being in healthy spaces and safe spaces? And those can be some really big questions. So we've got an unprecedented time, a lot of uncertainty that people are working really hard to try to iron out here. And then, so how we've had to adapt too is brought us into our homes and possibly limited our connection to the things we do outside the home to cope, or just to feel better in life. If our dynamics at home have challenges or had challenges beforehand, that might be even more of a challenge as we're being asked to navigate our homes and our spaces. Another thing that I'm thinking of that, you know, I have experienced with my own family is, how do I find a place that protects confidentiality where I work? Because that's part of my job. How do my kids find a space where they can go and have their private time, and then they can have their time to engage in school and finish school? So, you know, everybody's navigating these things at home. And that can be challenging even if you get along with everyone at home. So, you know, these are just some of the things that it makes it understandable to me why some people might feel they're experiencing anxiety or stress more than they have, or there's a lift to that. Mm-hmm. And I actually think it's possibly we could put it in as a normal response to all these things that, you know, we weren't planning on dealing with. A pandemic, mm-hmm. You know, protests. So there's just a lot going on in the world right now.
Yeah. So like, going off of that, how do you feel that people should react? Like, how do you feel, what do you think a good mindset would be in order to kind of tackle this and be okay with what's happening?
Sure. I mean, it's a good question. And the one thing when I work with clients that I'm most fascinated with is a little bit less about like whatever information I have. And I guess I want to start answering your question by saying, we've gotten through 3 months. So have a think about first what you've already been doing, because we've all made it here. You know, we're all here on this Zoom call. Anyone who's listening, there is a way that you have adapted, you've coped, you've pivoted, and I'm sure you can identify some things that have brought you to this moment right now. And for me as a therapist, that's more fascinating to me to know about someone, about what they've already done, as opposed to being more prescriptive. But of course, I do have some ideas about what you're asking too. One of the things that can be helpful is just to maybe have like a little inventory or a little self-reflection, whether you write things down or not, and just identify your stressors. And, you know, as much as you want to engage with that, you do that. Take breaks if you need to. And then once you go through your list, have a circle around the things that are actually in your control fully, or at least partially. And so when we start to identify what's actually in our control, and, you know, if you approach it in the way that I suggest, like you make this fuller list, a couple things can happen. One is you can begin to identify, when you're motivated to do so, where you might have some impact. And that could have a positive effect. That can make you feel like you have agency. There's something you can do, and that can really help people. And if you decided to engage in a broader list, even if there's things that are not in your control, you can begin to understand maybe why it is that you're so stressed out. You know, and that can connect you with some other mindsets that are helpful, like, you know, offering yourself kindness and compassion and some understanding about why this time might be difficult for some of the reasons I already talked about. But when you just kind of do that little check-in and identify the things that are in your control, it can really connect you with how you can affect what's in your control if you choose to, and then maybe have some compassion for yourself and kindness around why this time in particular might be more difficult than others. I think that those are the things that I want to just sort of name right now. Does that make sense?
Yeah.
Yeah, okay.
And then kind of in addition to that, do you know any like small habits or coping methods
and like things that you can incorporate into your daily routine that people could use to manage their anxiety?
Yeah. Yeah. So, I didn't mention this earlier, but I think you all know I'm a yoga and mindfulness teacher. I do the mindfulness-based stress reduction for a teens class, but I've also been a yoga teacher for 20 years. So for me, the little things, the informal things, or the things that maybe you decide to put in your day that could be really helpful tend to revolve around those practices. But again, if you just have a think about your life and what's been working for you in the last 3 months that's helped you kind of reach that place that's calmer, you might decide to put more of an emphasis on that. Like I talk to a lot of teens and I hear a lot of responses about what they're already doing, right? And it may be, walking your dog, connecting with your dog, art, listening to your favorite music, and actually for some, being very deliberate about the music that they listen to, because just like some really upbeat music could shift a mood in an up direction, kind of downer music can have another effect, right? So just being very conscious and more aware of that. I could, if you like, take you through just maybe like a couple minute breath exercise, though, if you were
that'd be
game for
great.
that.
Good idea.
Okay, so this would be an example of something, from my world, of the things that work for me and that I teach in the, when anyone is interested in mindfulness-based stress reduction. And, the first thing you could start with is just taking a little bit of a movement through your 5 senses. And the first one I'll encourage you to connect with is your sense of sight. And you can always make a decision whether it feels more comfortable for you to have your eyes open or closed. I know there's maybe some imaging in our culture around, when we do these mindfulness things, you automatically need to close your eyes. And that's fine. It's always great to have a line of inquiry with whatever you do about what actually works for you. So eyes open or closed. And then you could just notice what it's in your sight lines. Like I'm looking around my room and there's some objects that I know are in my room. And, it can be helpful to take a look around if you like. And maybe your eyes are closed and you're not doing that. That's fine too. And then when you feel ready to do so, you can move your attention to your hearing. And you can notice what it's like to listen to the sound of my voice. You might notice that there's other sounds in your environment that are part of the present moment. And then just taking a little bit of a shift when you're ready to noticing taste. There might be a taste of if you have gum or Tic Tac, or the last thing you ate, or you could notice if your mouth is dry or moist. And taste has a close relationship to smell. So you could take a moment and move to just seeing if there's any smells here or not. And then the nice thing that I like to do is just weave in or thread in, as we're sort of lingering around our sense of smell, noticing your breath for a few moments and allowing your breath to be exactly what it is. There's no need to make it deeper. If you did, you could just notice that. One of the things, if I only have a few seconds to connect, take a pause with the intention of just wanting to calm my mind a little bit more, is